Hi everyone, I'm Lauren. I'm the case manager at the Albany Med Specialized Care Center. We have Kate.
Hi, I'm Kate. I'm one of the nurses also at Albany Med Specialized Care Center.
As some of you may be aware, we have PrEP Aware Week next week, which is October 25th through the 31st. So we are here. We have two of our doctors and a nurse practitioner from our program that we are going to do a panel discussion asking questions about PrEP. So if everyone else maybe just wants to briefly go around and introduce themselves, then that would be great.
I'm Debbie Tristram. I'm the medical director of the Specialized Care Center for Adolescents and Young Adults, and I'm here to answer questions.
Hi, I'm Heidi Finkel. I'm a nurse practitioner with the Specialized Care Center.
Hi everyone, I'm Brian Bucco. That's for Real Talk.
Hi everybody, I'm Shannon Andrews. I'm one of the doctors at the Specialized Care Center.
Hello, my name is Mars. I am one of the HIV Stops With Me spokesmodels, and I'm just to help answer any questions that I might be able to.
Hi everyone, I'm Stephen Shalat. I'm the digital outreach specialist with Real Talk at the Alliance for Positive Health.
My name's Mani, but you could call me J Mani or Mani, it doesn't matter.
Hi, I'm Faith. Nice to meet you.
Hi everyone, my name is Crystal. I'm a youth prevention intervention specialist with the Alliance for Positive Health under the Real Talk program.
What up? I'm Javi. I am a youth advocate for Real Talk.
Thank you. And I'm Hannah Freary. I'm a program manager at the Alliance for Positive Health with the Real Talk program. I appreciate, before we get started, all of you that have come here to not only answer questions, but to ask questions. I think PrEP and youth is a really, really important topic. And I know our youth came up with some really, really amazing questions. So, Dr. Andrews, if you could give us an overview of PrEP, that would be awesome.
Yeah, no worries. So PrEP stands for pre-exposure prophylaxis, which is fancy words for preventing something before it happens, basically. And PrEP is one pill that you take once a day to try and prevent HIV.
All right, we're gonna start with Mani. If you would ask your first question of the panelists, that would be great.
My first question is, what are the side effects or risks of taking PrEP?
So that's a really great question, and one that everybody who's taking any kind of medication that's new to them should ask. The side effects of PrEP, there are some potential side effects either on bone tissue, which means that when you're taking the medicine, you might lose a little bit of your bone while you're taking it. The other one is that there can be occasionally some kidney risks, but we try to minimize both of those by keeping a close eye on people, by doing blood work and making sure that their history, their personal history, is okay for them to take that medication, if that makes sense to you.
Great, thank you. Mani, do you have your next question?
My next question is, who can take PrEP?
Most people can take PrEP. We do like to know people's personal medical history for the reasons that Dr. Tristram talked about. If you have problems with your bones or your kidneys, sometimes we have to make some adjustments to the medicine. But basically, anybody that's at risk for HIV, whether that's through sex or through IV drug use, can be on PrEP.
Is the process simple enough to make teens feel like it's worth it?
We can answer that question.
Here at the Specialized Care Center, we try our best to make it as simple as possible. Basically, the follow-up for PrEP, usually we see patients initially, we do some testing. Lauren will get into it a little bit more about like insurance coverage and that kind of thing. Once we do all the testing and prescribe the medication, we like to have you start it within a week of taking it. And then we'll usually give you a call after a couple weeks just to check in and make sure everything's going okay. And then we like to see you again here in the office after being on it for 1 month. And then we just follow up routinely every 3 months to repeat STI testing, and like Dr. Tristram mentioned, just check on your, like your kidney and liver function, make sure you're not experiencing any harmful effects from the medication for that. So we try our best to make it really simple and just really routine follow-up. And aside from that, like I said, I'll turn it over to Lauren about just like payment for the medication and insurance coverage.
Yeah, so with our program, we try to work with patients, especially teens who aren't necessarily savvy at navigating the whole insurance thing. We try to work with them. We'll call their insurance company with them. Just try to really sit down with the youth and young adults to make it worth their while and help them in any way we can.
Okay. My next question will be, where can you get PrEP?
So there are lots of places within the Capital District that you can access PrEP. You certainly can, locally, you can come to our office at 22 New Scotland Avenue. We're here Monday through Friday, and you can call our prevention line, which is 518-262-9789 for either the same day appointment or the next day appointment. You can access PrEP through Planned Parenthood. There are some primary care providers locally who are willing to prescribe PrEP, and they can follow the guidelines. And lastly, Whitney Young is available for PrEP for youth. So there are lots of options. One of the other people in my team, maybe you could also mention that that there are places online where youth can look to find where the closest PrEP provider might be to them. New York State Health Department has a list of PrEP providers, if that would be helpful.
Yes, thank you.
Thanks, Monty. Faith, do you want to ask your questions now?
Yeah. All right. So, how long must a person take PrEP for?
So that's also a really great question. The whole purpose of PrEP is to protect the person during the time that they're having risk. So they only need to take it for as long as they consider themselves to be at risk for HIV. Sometimes people might take it for months, other times people might take it for years. But again, really just during the time that they consider themselves to be at risk for acquisition of HIV.
Good to know.
If I can jump in for a sec, how long do you have to take it before it takes effect?
So it's recommended that you take 7 days of PrEP consecutively in order to achieve adequate tissue concentration in rectal tissue. So for someone that's engaging in receptive anal sex, 7 days. For genital or blood exposure, 21 days is necessary to get to the optimal level of protection.
Gotcha. Thank you.
For my next question, will PrEP give people an excuse to not wear condoms anymore?
So PrEP is really, it's part of a comprehensive plan to reduce your risks. It doesn't protect against STIs, so using condoms is still important to help protect your health and reduce your risk in that regard.
Okay. Is it okay to give HIV negative people anti-HIV medications when we have HIV positive people who have trouble getting HIV medications?
So that's a good question as well. But in New York State, everybody that's living with HIV should have good access to medical care and medicines. There are many, many providers and programs to help with this. No one needs to not be able to take HIV medicine because of finances. New York State makes that easy with programs like ADAP, which will pay for physician visits as well as the medication. So if you're taking PrEP, you're not taking away from people with HIV that need this medication. There should be plenty of medication to go around for the HIV positive people, as well as for those who desire to prevent themselves from catching HIV disease.
Okay. For my last question, can taking PrEP while pregnant affect the baby?
So that's also a very good question, and a question that all pregnant women should ask about all drugs and medications that they take during pregnancy. And the short answer to that is not really, because when a woman has HIV, we really want to protect the future baby from developing HIV, and so she will be on her HIV medications. And one of the very common regimens for women with HIV in order to prevent transmission to the baby is for them to take Truvada, which is one of the PrEP medications, in addition to taking Icentris. So a pregnant woman with HIV will be taking more medication than a pregnant woman who was desirous of taking PrEP.
Okay.
All right. Excellent. So I'm going to pass it off to Javi to see if he can get his questions in before the end of the time.
Can I take PrEP with other meds I am on?
So yeah, that's a really good question too. Anytime you're on a new medicine, it's good to check with your doctor or your provider. PrEP is pretty safe, so there's really not any interactions with any other medications, but it's good to check each time.
All right. Does a young person need parents' permission to take PrEP?
So I can answer that question. So New York State Department of Health regulations actually allow minors who are over 13 years of age to consent to their own care for any sexual health related care, any pregnancy care, or any HIV testing or treatment.
Also, just to add on to that, I think we mentioned before about, patients who might be on their parents' insurance but have privacy concern and want to access PrEP and testing. We can help you kind of navigate the, insurance phone trees in order to have you get the services still without your parents' knowledge. Because like Heidi mentioned, it is the law. You do have the right to that care. So good stuff.
All right. If I drink alcohol and or use recreational drug, is it safe to take PrEP?
It's safe to take PrEP. If you're using alcohol or recreational drugs, there's not a bad interaction with the medication. But the problem that happens when you do alcohol and or recreational drugs is that it may alter your ability to think clearly, and you may take much more risk than you should if you're using those medications while you're taking PrEP. Might leave you at risk for pregnancy or contracting STIs if you're not thinking clearly about how to protect yourself in other ways besides just against HIV.
Can PrEP prevent pregnancy?
PrEP can't protect against pregnancy. It's specifically meant to protect against HIV. There are some medications that may come in the future that bundle some of those things together. But right now, no.
My last question is, what is Truvada and Dyskovia? What is the difference?
So Truvada and Dyskovia are the two different medications that are approved for PrEP. So Truvada we've had for longer, so we know more information about how it affects different people's bodies. It does have some side effects, both of them do, but Truvada tends to cause a little bit more trouble with the bones and the kidney like we were talking about, whereas Dyskovia has a little bit less of those side effects, but can have some other side effects like weight gain. So there are some subtle differences between the two, but both of them work to prevent HIV.
All right, thank you.
Thank you all, and thank you so much to the teens for their questions. So we have about 3.5 minutes left, and I wanted to ask a question to maybe you could leave us off with, and this question is for Mars. Why would a young person want to take PrEP? Why would any of the youth on this call or, any of their friends want to take PrEP?
I think that some people might want to take PrEP. I think maybe the situation I'm in kind of is a good example of when you start to get relationships and things like that. PrEP may be a good place to start, especially for me. I'm HIV positive, my partner's HIV negative. So a conversation of whether or not they wanted to be on PrEP started in the very beginning of our relationship, really. So I think there's different reasons why you might want to, but I think that it can be somewhat of a peace of mind for you, if you will. If you're on PrEP and you are maybe dating someone or end up dating somebody who is HIV positive, it can kind of be kind of a peace of mind of knowing that you're doing what you need to do to protect yourself, not only with contraceptives and condoms, because it doesn't take the place of those things, because as we said, it doesn't prevent pregnancy. So if you don't want to get pregnant, you still have to use condoms. But if you also don't want to get HIV specifically, PrEP can help you in addition to those contraceptives to help you not get any other STIs and things like that. So I think it's, important to be in touch with your sexual health and asking yourself whether or not PrEP would be for you or PEP. I know we didn't talk about that one too much here, but knowing that those are options for you, I think is really the first step in awareness, so that way, if and when maybe you are interested or encounter someone that does have HIV or AIDS, you don't have to be so reserved about how you encounter them, because you kind of take control of your own health and your own sexual health by saying, okay, I want to take PrEP, or can we talk about this? And I can guarantee that if someone is HIV positive, they're going to want to try to keep you safe as much as possible. So it would be a good conversation to have. Also, I mean, PrEP isn't necessary in friendships, but understanding how PrEP works, understanding that PrEP is an option, maybe you're friends with someone who has HIV. It could kind of help you defend the fact that defend the stigma that happens, that people with HIV or AIDS shouldn't be dated or shouldn't have sexual contact with people and things like that. I think PrEP is a good way to go.
Thank you everyone for taking part in this and for taking the time to talk with the teens. And teens, thank you all for your time and have a great afternoon.